Good evening, everyone. Amy, how are we coming along with the live stream?
He's working on it. He'll tell us when it's ready.
Okay.
All right, folks, we are live on the internet and we're ready for the meeting.
All right, we will call this meeting to order. Al, can you do roll call for us, please?
Benson.
Benson's here.
Commissioner Benson is present. Sarda.
Sarda here.
Commissioner Sarda is here. Fertig.
Fertig here.
Commissioner Fertig is here. Hoffner.
Hoffner present.
Commissioner Hoffner is present. Minor.
Minor's present.
Commissioner Minor is present. Moser.
Mosier present.
Commissioner Moser is present. Schramm.
Schramm present.
Commissioner Schramm is present. Weber.
Weber's present.
Commissioner Weber is present. Johnson.
Here.
Mayor Johnson is present. City Manager Leon.
Here.
City Manager Leon is present. City Attorney Denherter.
Denherter here.
City Attorney Denherter is present.
Thank you for that, Al. Good evening, everyone. Now's the time for public appearances. So if there's anyone either in the RTech meeting room or on YouTube who has something to address the commission about, which is not on tonight's agenda, now would be the time to do that. Al, is there anyone in the meeting room who wishes to address the commission about something not on the agenda?
No addressing. Kelly is here taking pictures from the P&D.
All right. Brad, anyone on YouTube?
This is Dave covering for Brad, and there's nothing on YouTube at this time.
Okay, thank you very much. Since there are no public appearances, we will move on to old business. Number one is the second reading and public hearing of ordinance number 1033, an ordinance recommendation by the City Health Board regarding COVID-19 temporary emergency ordinance number 1. What is your pleasure?
I'll move to approve. This is Sarda.
Weber seconds.
We have a motion and a second. Amy or Ross, for our viewing audience, do you want to give an overview of what we're doing here?
Sure. Ross, if you don't mind giving the overview of the actual ordinance language, and then I'd like to address the commission regarding some of the comments that we've had that I've been asked to forward along from the public.
Sure. The emergency ordinance effectively accomplishes two things. The first of which is to close a number of businesses that involve a lot of social congregation and or close contact between patrons and the employees. There's a laundry list of businesses, including all restaurants, coffee houses, bars, breweries, dance clubs, gentlemen's clubs, cafes, and other similar places of public accommodation offering food and beverages for on-site consumption, including any alcohol licensees with on-sale privileges. Those businesses may permit takeout, delivery, curbside service, and drive-through service. Recreational facilities, pools, health and fitness facilities and clubs, social clubs, fraternal organizations, athletic and weight training facilities, barber shops, hair salons, nail salons, tanning salons, spas and massage parlors, estheticians, tattoo parlors, dog grooming salons, movie and live production theaters, event centers, meeting halls, and music and entertainment venues. tobacco shops and lounges, vaping shops and lounges, hookah lounges, and other similar businesses are closed on-site consumption of any product by smoking or inhaled vapor. Pool halls, video game arcades, video lottery casino operations, bowling alleys, indoor ice skating rinks, and other similar recreational or entertainment facilities. All of those closures shall remain in effect through Friday, May 1st of this year. We have also provided a list of closures that are expressly not included. That includes places of public accommodation that offer food or beverages for off-site consumption, including grocery stores, markets, retail stores that offer food, convenience stores, pharmacies, drug stores, and food pantries, other than any portion of such businesses which would have been subject to the closure requirements we've already gone over, room service and hotels, healthcare facilities, residential care facilities, congregate care facilities, and correctional facilities, crisis shelters, homeless shelters, churches, soup kitchens, or other similar institutions, any emergency facility necessary for the response to the current public health emergency or any other community emergency or disaster, any outdoor recreational facility where safe distances between patrons may be maintained, for instance, the outdoor portions of any golf course or archery range, daycare providers, and the list of closures and the list of those that are exempted from closure may be amended by a recommendation of the City Board of Health and a passage of a resolution of this body, the Yankton Board of City Commissioners. The second level of regulation that we have regulated by virtue of this ordinance is the size of any communal gathering. We are not allowed to gather in groups of 10 or more in this city under this ordinance, except in the following places, so long as people take care not to be within 6 feet of one another for extended periods. That includes public parks, sidewalks, streets, and any outdoor recreational facility where safe distances between patrons may be maintained. Again, that includes the outdoor portions of any golf course or outdoor archery range, parking lots and common areas of any hotel, office building, or residential apartment building, grocery stores, shopping malls, manufacturing facilities, daycare providers, or other retail or business establishments where larger numbers of people may be present, but where it is unusual for people to be within 6 feet of one another for extended periods, hospitals, mental health or substance abuse treatment facilities, and medical clinics and facilities, long-term care and assisted living facilities. And this list may be amended again by recommendation of the City Health Board and approved by resolution of the Yankton Board of City Commissioners. Any extension of these regulations beyond May 1 are limited to the sunset date of June 8, 2020. If any regulation is desired by the Board of City Commissioners beyond that date, a new ordinance must be passed. A violation of this ordinance would be a Class 2 misdemeanor, punishable by a fine of up to $500 or up to 30 days in jail as determined by the court.
So we've had quite a bit of public comment on this ordinance, lots of questions, and we've done our best to answer those. I just want to go sort of through the major topics that we've heard about, and I'm sure the commissioners themselves have heard some comments as well, but here are some of the things that we've heard. First of all, I want to start out with lots of comments and emails, texts, etc., of support for the ordinance and indication that many folks believe this commission took prudent action with this ordinance and thanked me and the city commission and the health board for bringing this forward. So lots of comments there. A number of comments, I would say 4 to 5 comments received about dog grooming, folks feeling that the dog grooming was an overreach and should be excluded. Lots of comments about hair salons, particularly of those folks who either have a large space who could operate with very few people and some distance between some of the folks in those spaces, or a number of people that have sort of one-on-one businesses that are not, not large salons, more of like an in-home salon or a place where they can do hair or other beauty services for one at a time. So we heard those comments as well. We also heard some comments from people who work at various places that remain open, who were concerned that their employer may not be following the protocol, either the hygiene protocol or the limited protocol on how many people can be congregating in small spaces, etc. So we're working with the chamber actually in YAPG to help us educate people on those types of items. Those are the major comments and questions we had. Also some questions about video lottery. Can I be open? Can I not be open? Et cetera, et cetera. And so we've answered a lot of those questions, but the major concerns were those that I outlined, and I'm happy to answer questions that the commissioners have.
Commissioners, questions?
This is Commissioner Mosier, and I would be one, to be honest, that received quite a few questions or discussion points on hair salons. With some of them volunteering to alternate days, limit the number of people in there, put up signs, limit services to really only hair, to not do nails, pedicures, facials, to just only do hair, and to work with their clients. I know one of you saw that we got an email from somebody that works with an elderly woman who can't raise her arms above her shoulders, and has been getting her hair done for years. So I guess I bring it up because I want to open it up to all of you for discussion. Ross, maybe this is a good question. And I think you referenced it. If we do get into some of this discussion tonight, what are our options, or does this go back to the health board? I guess, as we discuss this, what are our options as we move forward for the public to know as well?
Okay, your options would be to pass it as written. It would be published tomorrow in the Yankton Press and Dakotan, and then it would be effective tomorrow. Any subsequent change could be made following a motion or approval or recommendation by the Board of Health and a special meeting of this board. So effectively, if we wanted to make further changes, we could make a change potentially as early as Wednesday if a special meeting was called. If you wish to change any of the listed businesses, I would argue that that potentially constitutes what's referred to in the statutes as a substantial change to the ordinance. If any change like that is made, we are prevented from passing that particular ordinance for another 5 days. We would have to effectively have another second reading 5 days, no earlier than 5 days after today. So if we want this to be effective tomorrow, my recommendation is to pass it as written.
Just another comment for you all to chew on a little bit here as you're having discussion. I will say that the health board met today because we too have heard all these comments that you have heard, and we've gotten the emails and talked about many of the topics. The recommendation from the health board remains as our recommendation was when it was presented to you. We do not feel at this time that we should make any changes. You all made some changes in our original draft to our original recommendation. However, that's your purview. We do not feel that changing anything at this time would be prudent. We think that there may be a need to look at that in the future. But that's the recommendation from the health board. Certainly you can make those changes if you'd like, but we're recommending that you remain with the language that you have. The other thing that I want to talk about with you all is enforcement. You know, we plan to start moving forward with enforcement, beginning with an educational process first, as we talked about. However, this isn't something that we're taking lightly. So we've already had reports of places that appear to remain open, and we followed up on some of those based on the comments we received this weekend. Some of them were not aware there was an ordinance in place, had not heard that. Others, you know, we've talked to them about what portions of their business could remain open, because it was a matter of them maybe having a video lottery area or something of that nature where they could operate a portion of their business but not another portion. So we're still working through that as well with them. But come tomorrow, unless you make any substantial changes, we'll be working really hand in hand with our business owners and with the police department to ensure that we're enforcing this ordinance. So that's where we're at as a staff.
Again, Commissioner Mosier here, quickly. So this that we're meant. If I understand something, maybe some of the businesses that were mentioned tonight incorrectly could be amended. You're happy to open all if they have a good business plan.
I'm sorry, Commissioner Mosier, I didn't hear that question. Your voice cut out. If somebody else heard it, could they help with the response, or maybe you could repeat, Commissioner Mosier?
Sure, I'm sure it won't sound as intellectual as the first time I said it, I'm sure. Just wondering here, I understand passing the ordinance tonight and the enforcement of it. Just making sure, I guess I clarify in my mind our options after, let's say we do pass tonight. I'm not putting the cart before the horse by any means. But if we do pass that tonight, can we, a week or two down the road, if we've been able to, you know, flatten the curve a little bit, is this one where we could potentially add businesses back in if they would present a plan that meets the requirements of what we're trying to do? Or is that not even an option moving forward, or later on if we see that we've been able to do this and we're feeling comfortable with maybe potentially a few gray areas that we're talking about tonight could come back online? That was my question.
Yes. That paragraph number 2, which contains the list of businesses in particular that are in this, I guess what I'd say, in dispute, or there's room for debate as to whether they should remain open or not. That provision in particular specifically allows you guys to allow some of those businesses to reopen.
And if there's unique situations, we can certainly, we want to one-on-one speak with business owners if they have unique establishments, and we can help them find a way that would fall within the confines of our ordinance. I know community development would be more than happy to work with folks on a plan. What we're saying as the health board, however, is that we think that generally the recommendation needs to stand as it is.
Is Dr. Milroy with us this evening?
I don't see her there. I can give her a call and ask her to join if the commission would like.
I was just going to say, maybe you remember exactly what she said, Amy, but during the health board meeting today, we did discuss hair salons, barbershops specifically. And she said, based on what we know today about how the virus spreads, it's hard to imagine where you could have a safe space because it can be transmitted via just breathing. That's what Dr. Milroy shared with us. So I guess you could maybe mitigate that if everyone was wearing masks. But, we're certainly not alone in closing salons and barbershops. Every state around us has taken that action. Nebraska hasn't done it on a statewide level, but when they have community spread, they have extended that. So, I don't think we're outside the lines here in determining that we're best off closing those types of businesses at this time.
This is Commissioner Fertig. I think it's important that we do pass this as it goes tonight, but I feel that we've had enough comment and enough questions that would warrant at least some discussion in the future, in the near future, whether it be with the health board recommending the closure of the salons, to tanning beds and pet grooming, which I understand, if I remember right, weren't even recommendations from the health board to close, which we decided to do anyway. I think that's enough. There's been enough information there that we should at least warrant another discussion. Mayor, if you'd be willing to schedule a special meeting like Wednesday to at least have the discussion about that, and then we can move on with this passing this ordinance tonight.
I think that, and certainly either two commissioners can call a special meeting or the mayor can call a special meeting. I would recommend to the commission they, continue to follow the process of health board recommendation, in that, we do have a medical professional involved on that health board. However, if the commission wants to create a work session just for the sake of discussion, we're not far enough along yet to start talking about any future next steps. But if you want us to start looking at the independent businesses that you selected here in your ordinance, we can. To me, we're premature there on that. However, we'll take the commission's direction. It will be hard for us to be ready for a special meeting on Wednesday, is what I'm trying to say, because we're going to be now in the mode of enforcement tomorrow, and that's going to be, that's going to take some time. But if two commissioners call a meeting or the mayor calls a meeting, we'll make it work.
I did say that, go ahead, Amy.
Hey, Dr. Milroy.
Hi there. I was listening on YouTube. I didn't get a link today, so I didn't know I was supposed to be on the screen. So I was listening on YouTube. So I did hear Nathan's question. We talked some about that again today at our meeting. And the concern was that I think originally it was felt that that the coronavirus would really mainly travel in droplets, which means they're bigger than about 5 micrometers in size. But it seems that there has been a little more case reports. I know there was a choir out in Washington and some other places where there was a high rate of infectivity, and they were very concerned that it might be demonstrating more of a droplet or an aerosol versus a droplet spread, which are smaller. They tend to not have to be a sneeze or a cough. It could just be air. And certainly in the choir, they thought it was the singing, but it got into the air. And there's some concern that if that is airolized and there's close contact like that, that it could still be quite infectious. It maybe would be viable from 30 minutes to as long as perhaps 2 or 3 hours on surfaces. And so I guess with some of that, and knowing this is a moving target, they only discovered the virus in December. So, do we have tons of evidence or solid stuff? It's kind of a moving target, but it looks like there is certainly some credible evidence more recently that it can also be aerosolized. So I think if we were going to err, we were kind of erring on the safe side and caution with that recommendation, knowing that each decision is tough. I would like to jump in for just a second. I would like to pass the ordinance as written tonight. I too have been hearing from salon owners and stylists, and these are people that we've known them forever, taught their kids. I went to school with them. I feel for them. And they're coming from a good place. They want to help their clients. And it's not vanity. There's a wellness. There's a feeling good about yourself that I get. There's no way to do that job with a 6-foot distance. And I feel like our stylists are thinking about, oh, we'll keep our clients safe, without thinking about keeping themselves safe. I want to keep them safe too. I think that's part of our job, is to make sure that they're not putting themselves in harm's way. I saw the commentary about the woman who's 90 who has trouble doing her own hair. I think the worst thing we could do is have her go out in public to get her hair done once a week, given what we know. The math in South Dakota has started. March 10th, it was 5 cases. It took us 7 days to double to 21. It took us 3 days to double to 41. It took us 4 days to we're at 101. The equation, the mathematical equation of this disease is unrelenting and unforgiving. And I think we have to stand our ground and take care of our people.
And this is Commissioner Sarda. Thank you, Amy. Commissioner Minor, I think you put that very well. You summed it up, how it's to protect a lot of people, everyone. I agree that I'd like to see us pass it this evening, and any future court questions, everything gets in front of our health board to bring more discussion to city manager and the commission as needed. So I'd like to see us pass it. Thank you.
Mayor Johnson, or Amy, you guys are both on the health board. Can you go back in your conversations back last week on the first recommendation to the commission? Could you tell me if tanning beds and pet grooming was on there?
Sure. No, it was not. And we did not discuss pet groomers. I don't think that's something that came up for us. And we had discussion about that today a little bit, nor did tanning beds come up. I don't believe, Commissioner Fertig, that any of us intentionally left the tanning beds out. I think it was something we didn't think about, certainly something that didn't cross my mind, nor did dog grooming. As you recall, we also had chiropractic care, dentistry, as well as optometry in that ordinance, and that's something that the commission chose to take out. So I guess in our mind, those things couldn't be practiced without close proximity. So we felt the same way as you guys currently feel about hairstylists in terms of chiropractic, optometry, and dentistry. However, with the discussion that you had and the testimony from one of our local chiropractors, it was made clear that some of that work is preventative and helpful for patients. And also there's some emergency care that goes on there with problems that could keep people out of a hospital or a clinic using these other services. So I believe that was your thought in putting those types of businesses in. The health board, the voting members of the health board are here. And, I won't speak for everyone. I have a personal opinion about dog grooming and tanning beds. I do, however, think that probably the best thing to do is to move forward, because any way we can limit the social contact now, I think is a critical in nature. But if tanning beds and dog grooming, if the commission and even hair salons, the commission would like the health board to take a deeper dive into those three, We have already scheduled a meeting on Thursday, tentatively at 4 p.m. of the health board, to see what else might come up in the community in the next couple days. So we could certainly dig into those further.
Yeah, this is Commissioner Furry again. Yeah, I would like you to. I mean, just a couple points that I've with the pet grooming and stuff. You know, this from what I've been told, and my knowledge on this disease does not pass to animals, to or from animals. So I would say pet grooming, other than the only human contact you got when you drop a pet off and you pick a pet up. The rest of it's all, you know, the groomer and the pet. And then you go into kind of tanning salons, and some people actually need a tanning bed for medical purposes. Just a couple bits that I've been hearing. I think it's definitely worth the conversation if you could have that.
Sure, I can certainly put that on the agenda.
Any further commission discussion? Al, is there anyone in the meeting room who would like to address the commission on this item?
There's nobody in the meeting room at the present time.
Dave, anyone on YouTube with feedback that the commission should hear?
We have a couple people commenting with multiple comments. One of the comments is about if we close salons and other businesses to that effect, and this is from Covo 12, Virginia, what will happen is that their clients are going to go to Sioux Falls, and that person would also like some discussion about too many people being in other businesses in town, for instance, the clothing section at Walmart and Menard and other locations in Menards. Firestorm comments that the other states around us are not being logical. So that doesn't mean we can't be logical. And kids playing on a playground is far more contagious than a dog groomer. He or she also says that should make the most dangerous list of businesses based on the 6 feet rule and 10-person rule. Grocery store aisles aren't even wide enough for that distance. And I think that covers everything up to date.
Okay.
I think, Mayor Johnson, if I could say something kind of along what Commissioner Minor said, I think the hard part in what I hope people understand is if you're on this list and we're recommending a closure at this point does not mean that you are not important to our community, nor that we think that you are not responsible enough to keep your business clean. It's more of a health and safety issue. And I just want to stress that because every business we're talking about is important to this community and a vital part of what makes our community great. So I don't want anybody thinking that by being on this list, we think they're any less important to the overall function of this community, that it's strictly coming from a health and safety spot, at least for me. So I just wanted to clarify that.
And I would jump in and follow that. Commissioner Mosier, thank you for saying that. This is coming from a place of love, of wanting to protect people in our community. Dr. Birx, this morning on the Today Show, she is one of the medical advisors to the presidential COVID task force team, said, and I will quote her, "No state, no metro area will be spared. Even if rural areas don't see the virus in the community now, by the time it does appear, the outbreak will be significant." We have been lucky so far, and I don't know if it's because we're lucky or because we don't have enough testing, but our numbers are low. The time to act, to protect one another is now.
And I think that's a good point. You know, some people may think this is a metro problem, but I saw reporting today that cases in both the rural and urban counties in the U.S. increased between 41 to 50% over the weekend. So yeah, the numbers aren't as big here, but the increases when you compare the populations is the same. So we will not be spared. The State Medical Association, this is something Dr. Milroy shared with the health board last week. They have asked the governor to close all non-essential businesses in the state. So we aren't quite there yet, but that's what our medical professionals are telling us to do. They, along with the Nurses Association and others, put out an open letter to the public last week asking people to stay home, to give them a chance to care for the patients that are going to be coming their way already, because we know this virus is in our communities. And so this is really a matter of life and death. That's what we're dealing with here. And I just think, if any of us were asked, what would you sacrifice to save one life? What would you sacrifice to save 40 lives? I think our answer would be the same. We would do most anything to prevent the loss of life. And this is an opportunity where we actually have the chance to do that. And, South Dakota is not alone in that. Yankton's not alone in that. The entire country is going through shutdowns right now. The entire country is making a sacrifice so that these patients have a chance, so that our healthcare workers have a chance and don't have to be in the position of choosing who lives and who dies. So that's what this decision is about. It's not about crippling our economy, because none of us want to do that. So I hope no one takes this personally. It's like you've said, it's not about us not thinking someone is important or their business is important, because we certainly do. It's just we are measuring it against public health right now.
I guess trying to listen, but I jump in there. Got me? Okay. Hoffner here. As soon as you read these letters and you talk to constituents across this fair city and you get comments, and the first thing you think of is, yeah, we can do that. We can open up that salon. We can open that video lottery. They're only going to have 6 people, and they promise. You could go on and on and on. And then you start thinking of the possible scenarios. And in aviation, I always use trends. If I have some problem, I turn around early. Otherwise, this is obviously the trend here, as Commissioner Minor alluded to, is not good. The trend, if you look at the graph, and it's tough. And I want to open. There's many of these businesses. As I drive around the city today, people are congregating. We're not following the distance between people and the outside. There's kids playing together. It's not happening. So we are still vulnerable. But I think this is one step we can help out, and where I would appeal to the business in town that wants to stay open. What if an outbreak happened in your business? Could you take that home to your family or to your parents or something? So it's just too scary.
This is Commissioner Schramm. I just want to reiterate too that none of us on the commission are disease specialists. I think we have to absolutely listen to the recommendation given by the medical field, because you can't trust Facebook, you can't trust other media sources. You have to listen to those that know what they're talking about. And as hard as that is on our businesses, I don't see any other choice but to listen to the recommendations of our medical professionals.
Any more commission discussion?
I would just say that the letter was an open letter to the governor that encouraged closing of all non-essential businesses. And it was signed by the South Dakota State Medical Association, which represents most of the physicians in the state, the South Dakota Association of Healthcare Organizations, which is almost every healthcare organization, including the large healthcare systems, small nursing homes. It's virtually all the healthcare organizations in the state, as well as the State Nursing Association. So all 3 organizations endorsed that and sent a very strong letter to the governor. So I think we're wise to try and align with those healthcare well-respected organizations in our state.
Thank you, Dr. Milroy. All right, any more discussion? Al, can we have roll call, please?
Okay, this will be the roll call on the passing of ordinance 1033 as presented tonight. We'll begin with Benson.
Benson, aye.
Commissioner Benson is aye. Sarda?
Sarda, aye.
Commissioner Sarda is aye. Fertig?
Fertig, aye.
Commissioner Fertig is aye. Hoffner?
Hoffner, aye.
Commissioner Hoffner is aye. Minor?
Minor is aye.
Commissioner Minor is aye. Moser?
Mosier, aye.
Commissioner Mosier is aye. Schramm?
Schramm, aye.
Commissioner Schramm is aye. Weber?
Weber is aye.
Commissioner Weber is aye. Mayor Johnson?
Johnson is aye.
Commissioner Johnson is aye. Motion passes to recommend the approval of ordinance 1033-9-0.
Thank you, everyone. We know this won't be the end of the conversation, so thank you for making these hard decisions. We'll move on to new business now. Number one is consideration of memorandum 20-80 regarding the request by the City Commission to forfeit their commission monthly pay or salary for the months of April and May. And what we are proposing to do with that salary is to donate it to the United Way's COVID-19 Relief Fund, which supports our nonprofit agencies who help individuals in the community who are going to need assistance during this pandemic and the accompanying economic crisis that's gone along with it. Amy, is there anything you want to add as far as explanation?
No, other than I wanted to let folks know that I have talked to Lauren Hansen as well as our finance office, because there was a question about could this money, if directed towards the United Way Relief Fund, be then followed up with you all so you can, do a tax exempt on your taxes. The answer to that's yes. United Way will work with our finance department. Also for the public's efficacy, that amount of the commissioners is $483.71 per month. And for the mayor, it's $665.11 per month. And in the memo, I said April and May 2020. So I wanted you guys to be aware of that. You can change that if you just want to do April, or I was just thinking we're going to probably be a couple months here where things aren't going to be totally business as usual. And we've already started things in March. So I just covered it for 2 months because you're paid monthly, but you can change that as well.
With that, do we have a motion?
This is Commissioner Mosier. I would make a motion to move forward with this memorandum of donating 2 months worth of pay.
This is Weber. I second that.
We have a motion and a second. Is there any further commission discussion?
Mayor Johnson, this is Commissioner Mosier, sorry. I would just love to point out to the public, because I did the math today, just out of curiosity, that's just a titch over $9,000. So if anybody wanted to do quick math there. So a good way for a couple small monthly payments for us to really add up to a nice amount. I know it won't solve everything in our community, but certainly I would hope makes a nice dent somewhere.
Any more commission discussion? Al, is there anyone in the meeting room who would like to address the commission on this item?
There is nobody in the meeting room at the present time.
Mr. Mingo, anyone on YouTube with input on this item?
No comments about this item.
Thank you. Al, roll call, please.
Okay, and this is a roll call of item 3.1, which is a recommendation of commission donation of 2 months salary for April and May. And we'll begin roll call. Sarda.
Sarda, aye.
Commissioner Sarda is aye. Fertig.
Fertig, aye.
Commissioner Fertig is aye. Hoffner.
Hoffner, aye.
Commissioner Hopper is aye. Minor.
Minor's aye.
Commissioner Minor is aye. Mosier.
Mosier, aye.
Commissioner Mosier is aye. Schramm.
Schramm, aye.
Commissioner Schramm is aye. Weber.
Weber is aye.
Commissioner Weber is aye. Benson. Benson. Apparently we've lost.
Aye.
Thank you. Commissioner Benson replied aye. Mayor Johnson.
Johnson, aye.
Mayor Johnson is aye. Motion passes 9-0.
Thank you. We did have a second item under new business, which was a recommendation from the health board. That was a placeholder in case anything came out of our meeting today, unless I'm missing something, Amy.
No, correct, Mayor. There are no new recommendations other than, what we discussed under your ordinance. So we do have a meeting on Thursday at 4 p.m. We'll follow up on the direction request from the commission on those types of businesses. And then if we have any recommendations coming forward, we'll make the commission aware. But at this time, there are no recommendations from the health board.
May I ask a question?
Yes?
Sorry, this is Commissioner Minor. So you're going to discuss tanning beds, dog grooming, and salons. Is that correct?
Correct.
Thank you. Is it also possible to discuss going the other direction if we have to tighten
Yes,
things up?
we're also going to be talking about that. So
Okay.
Ross and Dave and I will be in discussions this week about essential and non-essential services and classifying what those might be, and looking at what the federal government classifies those as, and what we might also classify those as. So we are now, hopefully we have a little bit of time where we can work on some of those things, so the next step isn't as rushed, and we can have some more well thought out information even presented to the health board for us on the health board to chew on and digest, to make strong recommendations to you. So going forward, the health board may have more than one meeting prior to coming to you with recommendations.
I appreciate that. Thank you.
Can I ask a question? Oh, sorry. You can finish up and then I have a question. Also, I guess, related to this, I know not an agenda item, but could somebody, I don't know if it's the health board, Amy, Ross, I've been getting a lot of questions from constituents on when do they get to find out who's impacted in our community. I know people had assumed that I have known information before maybe the public, and I'm reading it on the South Dakota COVID website and the governor's updates along with everybody else. So maybe just a clarification from someone for our community, just to know how this process works now that we do have cases. What do we know? What can't we know or don't know? What may or may not be released? Is there anybody that can speak to that for the community?
I can tell you, Commissioner Mosier, what the city knows is what is posted on the Department of Health website, when it's posted there. The only time we would maybe be made aware of something sooner is if the governor herself or someone from emergency management would present information to us. But we know where those cases are and the number of cases. All we have is county information. So I can't tell you, where these people live or what their names are or where they work. The Department of Health may or may not know that. I'm not sure, but we certainly do not. The only way we might have personal information is if we happen to know somebody personally who tests positive and that person themselves tells us. Otherwise, no, we don't have any other information And, you know, there's some reason for that. HIPAA violations are one of those reasons in maintaining people's privacy. But what we are doing is making recommendations based on cases and the types of cases that come forward. But that information is available to us at the same time as it comes to the public. So, you know, I can't stress that enough that we don't have that information before anyone else. I presume the healthcare providers have that information maybe before we do, but of course they would keep that private between their patients.
I can add a little bit more to that as well, because this subject came up with the county COVID-19 task force over the weekend, because we were getting a lot of questions from people wanting to know, where does this person work? Was I in danger? And as Amy said, we don't have any of that information at this level. So the COVID task force through Yankton County Office of Emergency Management actually put out a press release today outlining that fact, that we don't know anything more than what you see on the Department of Health website, and we don't know it before the rest of the public does either. One thing you would have noticed today on the Department of Health website is that Yankton County went from having no description as far as its spread to being in the minimal to moderate range. And that means there is a single case of community-acquired COVID-19. And what that means, that delay tells us that the Department of Health had an opportunity to do an epidemiological study of the cases that have tested positive so far. So they were able to determine that that case was contracted from within the community. So they are doing that on the back end. Of course, it just takes some time because that involves interviewing the patient.
Thank you. I mean, I understand that. I just thought it was really helpful for the community to understand what we know and don't know or can know in this situation. Thank you.
All right, any more commission discussion? We have exhausted the agenda. So if there's nothing more, I would ask for a motion to adjourn.
Minor moves to adjourn. Oh, Minor seconds.
We have a motion and a second. Al, can we do roll call?
Of course, and this is a motion to adjourn. Fertig.
Fertig, aye.
Commissioner Fertig is aye. Hoffner.
Hoffner, aye.
Commissioner Hoffner is aye. Minor.
Minor, aye.
Commissioner Minor is aye. Mosier.
Mosier, aye.
Commissioner Mosier is aye. Schramm.
Schramm, aye.
Commissioner Schramm is aye. Weber.
Weber is aye.
Commissioner Weber is aye. Benson.
Benson's aye.
Commissioner Benson is aye. Sarda.
Sarda, aye.
Commissioner Sarda is aye. Mayor Johnson.
Johnson, aye.
Commissioner Johnson is aye. Motion passes 9-0.
Before everyone leaves, I should mention, speaking of the COVID-19 task force, they have been trying to do Facebook Live interviews every day. So picking someone from the task force, it's usually been around between 3 and 5 in the afternoon, and talking with them about what they're focused on. So today they had a whole cast of characters, some people from the medical field, and Dave Mingo was there from the city. Commander Foote was there representing the police department. So that's a good way to stay informed about what's going on with the task force as well, just so everyone knows. With that, thank you, everyone. Take care.
Right.